There's Doug. Hi, Doug.
Hi.
Ooh, cool background.
I know. I'm not sure if I'll keep it or not. It was for a call yesterday. I think I'll change it.
Okay, I'm going to start letting people in. Jess, hold on one sec, though. Okay, we're on. So, Jess, in about 10 seconds.
Perfect.
Sorry, I had the wrong time.
Thanks for being here.
My pleasure.
All right, so we'll be getting started. Good afternoon, bon après-midi. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique, Dr. Brent Malachny, Associate Medical Officer of Health, Médecin-Chef Adjoint de la Santé Publique, and Dr. Doug Manuel, Senior Scientist with the Clinical Epidemiology Program at the Ottawa Hospital Research Institute, clinicien principal pour le programme d'épidémiologie clinique à l'Institut de recherche de l'Hôpital d'Ottawa. After the remarks, we will then take questions from media. Please go ahead, Dr. Etches.
Thank you, and thank you everyone for coming a bit earlier than usual today. I wanted to be sure that everyone had the chance to participate in today's anti-racism march at 3 o'clock, whether virtually or otherwise. And personally, I will be participating virtually and listening to what members of the Black community and their allies are saying. Some people have been describing this week's marches as a conflict between democracy and protecting the health of the population. I don't see it that way. There are two challenges to the health of our population that are raised by these marches. And one of them has far deeper roots and has had negative impacts on public health for far longer than the other. So anti-Black racism and racism against minorities makes our population less healthy. Racism, discrimination, and stigma are associated with poorer physical health, mental health, emotional health, and greater mortality. So my job is not only to control infectious diseases, but also to promote the health of the population by working with others to ensure that there's fair opportunities for health. Le racisme envers les Noirs et les minorités nuit à la santé de notre population. Le racisme, la discrimination et la stigmatisation sont étroitement liés aux problèmes de la santé physique, mentale et émotionnelle, ainsi qu'à une mortalité plus élevée. So, mon travail ne consiste pas uniquement à contrôler les maladies infectieuses, mais également à promouvoir la santé de la population en travaillant avec les autres pour assurer l'équité en matière de santé. We've seen how COVID-19 has stigmatized certain racialized groups. According to a recent report published by Public Health Ontario, it's about diversity and COVID-19. The most ethnoculturally diverse neighborhoods in Ontario, which are primarily concentrated in large urban areas, are experiencing disproportionately higher rates of COVID-19 and related deaths compared to neighborhoods that are less diverse. So the rate of COVID-19 infections in the most diverse neighborhoods were 3 times higher than the rate in the least diverse neighborhoods. And people living in the most diverse neighborhoods were also more likely to experience severe outcomes, the hospitalizations, ICU admissions, and deaths than people living in least diverse neighborhoods. Even after controlling for age distribution in the population, and the population's concentration. So hospitalization rates were 4 times higher. ICU admissions were 4 times higher, and death rates were twice as high. Les résidents des quartiers les plus diversifiés sont plus susceptibles de subir de graves conséquences, hospitalisation, admission aux soins intensifs et décès, que ceux qui vivent dans les quartiers moins diversifiés, même après avoir pris en compte l'âge et la concentration démographique. Les taux d'hospitalisation étaient 4 fois plus élevés. Les taux d'admission aux soins intensifs étaient 4 fois plus élevés et les taux de mortalité étaient 2 fois plus élevés. We need better data to understand how racism affects people's health, but it's clear that it does, and we're not waiting for all of the data to act. We're working with groups such as the Ottawa Local Immigration Partnership and with health system partners to collect race and ethnicity data in order to better understand the barriers to health and healthcare in Ottawa and health outcomes for people who are racialized. People have had disproportionately difficult impacts on their lives, and it is important for people to have a voice within our democracy to counter racism. So today, I am finding virtual ways to express my support and continue work within my institution to make changes to address anti-Black racism and racism against minorities. Ottawa Public Health is focusing on work that we all need to do to change how our programs and services support people who have the least advantage and who are harmed by racism. Santé publique Ottawa met l'accent sur le travail que nous devons tous accomplir pour changer la façon dont nos programmes et services soutiennent les personnes les moins favorisées et qui sont confrontées par le racisme. So today, I encourage you to take action by learning more about what is happening in our community and about how racism affects the health of our population. Speak to your children about racism. Speak out when you see racism happening. And recognize even when you yourself might be guilty of stereotyping or bias. When we have privilege, we need to work to grow the opportunities for people with less and ensure the voices of people with less advantage are heard. So we understand that people are hurting and we are listening. As for the other risk to the health of our population posed by the marches or raised by the marches, COVID-19, large numbers crowding within 2 meters of others does create a high risk for transmission of the virus. So Ottawa Public Health is providing information to make sure that people can make an informed decision and participate in an informed way. Be as safe as possible if you are marching today. Stay home if you are ill, and make sure that you present for testing for COVID if you develop any symptoms of illness in the 2 weeks following the march. Assurez votre sécurité autant que possible si vous participez à la marche aujourd'hui. Restez à la maison si vous êtes malade et assurez-vous de subir un test de dépistage si vous présentez des symptômes dans les 2 semaines suivant votre participation à la marche. Thank you for continuing to limit the number of contacts that you have as much as possible. And your work to physically distance in the days following the march continues to be important to limit deaths due to COVID-19. So together with Ottawa Public Health, the United Way recently launched their hashtag Facing Forward. It's a project that is launched because we continue to strongly recommend the use of masks when physical distancing is not possible. We recognize, though, that for many, acquiring a mask is not as easy as it sounds. So whether it's poverty or homelessness or isolation that make getting a mask a challenge, we need to fill those gaps and ensure that everyone has what they need to keep our communities healthy. We're asking the community to help in 3 ways where possible. You can buy, give, or even make a mask. We're committed to making sure that every person in the community is protected, and more information can be found on the United Way's website. Mon masque te protège et ton masque me protège. Thank you, and Brent, over to you.
Great, thank you, Vera. It goes without saying that 2020 has been a different and difficult year for all of us. The more we start to interact in public again, the more mindful we must be of our actions to prevent the transmission of COVID-19. Through everyone's actions, we've been successful in reducing the number of infections that would have otherwise occurred. Overall, we estimate that only a small percentage of Ottawans have been infected with COVID so far, perhaps as low as 1%, but possibly a bit higher. Regardless of the specific number, though, the key implication is that the vast majority of us remain susceptible to infection. The new cases and hospitalizations we report mean that the virus is still present in our community. In order to track cases within Ottawa and to limit transmission, please seek testing if you think you may be infected with the virus. Une grande majorité de la population reste susceptible d'être infectée. Les nouveaux cas et les hospitalisations que nous annonçons signifient que le virus circule toujours dans la communauté. Afin de faire le suivi des cas à Ottawa et de limiter la transmission du virus, veuillez vous faire tester si vous pensez avoir contracté la COVID-19. As more activities become possible, the new normal will be to consider how risky an activity is and how you can reduce the risk of transmission for yourself, your family, and others. In general, outdoor activities are less risky than indoor ones. The more people that are involved and the closer the contact, the higher the risk. Another important consideration is whether any of the individuals or the people in their households are at risk of serious outcomes if they become infected. De manière générale, les activités à l'extérieur présentent moins de risques que les activités à l'intérieur. Plus les participants sont nombreux et plus les contacts sont étroits, plus les risques sont élevés. Il est également important d'évaluer si les membres de ménage risquent de développer de graves complications en cas d'infection. As our city reopens, we are asking the public to be COVID wise and assess the risk of your chosen activity. Assess the situation, consider whether the activity is lower or higher risk or somewhere in between, and whether physical distancing can be maintained. Wearing a cloth mask is an important strategy when that distancing can't be maintained. For extra help on low to high risk activities, please see the OPH website for more information. The overarching need to prevent transmission of COVID-19 is of utmost importance as we get back to activities. We're in this together in every way. Everyone within the community continues to have a role to play in preventing spread of the virus, and we thank you for all of your efforts to do so. Thank you.
Thank you, Dr. Malakmi. Please go ahead, Dr. Manuel.
Thank you, everyone. If you remember, I usually focus my comments around projections, and I'll just start by building a little bit off what Dr. Etch was talking about with racism and social aspects of COVID, to say that I wasn't planning to talk about this, but just to let you know that to date, most of the projections that you've been seeing, both nationally and internationally, are broad projections which consider everyone pretty similar. And they've been really effective, I think, with a very clear message about what we need to do in terms of flattening the curve. But keep your eyes open. Over the next weeks, months, you'll be starting to see new types of models come out which have more sort of nuanced and more detailed information that will provide information more about social economic groups, and also the sort of more specific information that we need to assess how best to open, when to bring schools back, if we can do that, and other interventions such as that. So these more detailed models take longer to build, and they are very, very data intensive. And these data systems are being linked where we can see transmissibility across neighborhoods and ethnic groups. And these models are starting to come online. And so hopefully we'll be able to give better and better information for different groups and different populations, how COVID's affecting them and how best to reopen. So with that said, I think over the past week, we've been seeing a slow, gradual improvement in all the parameters of the projections here in Ottawa and largely across Canada as well. So all the parameters feeding into the models are improving, and then the projections forward are going down further. So compared to last week, we're seeing a slightly lower likelihood of high peaks as we reopen. and overall continuing that sort of decline that we presented in the previous weeks. And it's important to note that these continued improvements are happening as we're in these early phases of reopening. And so I think that there is some signs, early signs, that we are starting to follow that safe and smart social or physical distancing. It's pretty early, but when we look at information such as Google and Apple mobility, which is going up quite quickly, and we haven't seen it affect the projections yet. So at this point, the projections are suggesting some optimism that we can continue to have these discussions about reopening. That said, there's a lot of caveats in the projections. As Dr. McLaughlin said, there's tremendous potential for resurgence because there's so many susceptibles, the so-called second wave. And internationally, we're getting more and more information about the patterns of opening and how they're affecting projections and observed cases. And it's pretty checkered what we're seeing currently. So there's quite a few countries that are at the level where Ottawa, well, a moderate number of countries that are at the level of Ottawa, and some of them have been where we are before. And places like Italy have continued to see a reduction in cases, although they've had very high levels of activity. France is similar, and they're seeing increasing cases in the last week or two. And these increases are difficult for everyone to interpret, but they've been interpreted saying that we with a cautionary note. South Korea has had fewer control measures than us, but they've reinstituted control measures recently after observing an increase in cases. South America, there's Brazil, Argentina, Chile, very worrisome increases, and they are in an escalation phase. And they've had control measures that aren't that much lower than what we currently have in Ottawa. Iran, Pakistan, other countries are also going through very difficult times with the sort of same level of control measures that we have here. So cautionary note, optimism with cautionary note, and just trying to find that balance when we see the projections of saying that the projections are looking good, but it's pretty checkered with what we're seeing out there. So I think the bottom line is everything that Dr. McLaughlin said as we move forward will be successful if we can continue to do smart, safe physical distancing and safe opening. And I'll stop there.
Thank you, Dr. Manuel. So in the interest of time, I will quickly read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I'm through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. So we'll start with 104.7 Outaouais, 1310 News, CBC Ottawa, CTV Ottawa, Le Droit, Ottawa Citizen, Radio-Canada, and Rogers TV. Have I missed an agency? Great. I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll now start with 104.7 Outaouais, Olivier Beauregard. Olivier? No. Moving on, we will go to Jason White with 1310 News. Go ahead, Jason.
Hi there. Good afternoon, Dr. Etches. I'm wondering if you can expand a bit on some of your earlier points about the march today. And the messaging hasn't been a flat out telling people that they should not go to this march this afternoon and to stay home. I'm wondering if you can expand on some of the reasoning behind that and to help people understand why you've taken the tack you have and why OPH is doing what it's done. Is it that this issue is more substantive than a social gathering in a backyard, which is not allowed under the state of emergency? Or is it more that you sense this is a much larger movement than all of us, and that you're kind of accepting that messaging from OPH isn't going to prevent people, so it's more a a harm reduction tactic? I'm wondering if you could shed some light on why Ottawa Public Health has taken the approach it has to this march this afternoon.
So Ottawa Public Health is responsible for the overall health of the population. And so what I tried to point to in my overall comments was we have to look at many different threats to the health of our population. And racism is one of those threats. And so we understand the need for people to have their voices heard, that racism is affecting their health, and to absolutely tackle this challenge that's been with us for a long time and which has very significant impacts on the health of our population. At the same time, we are asking people to stay home if they're sick. We don't want to see the event cause transmission of COVID-19. We are asking people to do the physical distancing that makes a difference. We know people will show up, they will march, and so it is a harm reduction method. It's a one-time event, and it will make a difference. The people who are showing up care for one another and do their part to wear a mask and to self-monitor, to limit their contacts afterwards. We will be continuing to communicate with the public if it looks like this has created transmission of virus in the community. We'll make sure that people know that they need to present for testing if they've potentially been exposed. This is something we need to work through and manage. We also need to address anti-Black racism and racism in the community, and we're encouraging people to do that and to make their voices heard virtually as the safest option.
Thank you. My follow-up question, I'm wondering if you have like a list of most important things to do or not to do during and after the march. I know you touched on limiting your contacts after, but mask wearing, hand sanitizer, that sort of thing. What would you recommend people do or not do during the march this afternoon and immediately after?
The most useful thing is to keep the 2 meters distance from others if you can. That will definitely help protect, as well as wearing a mask. Avoiding yelling, that will avoid more projection of virus particles if people are infected. Making sure that, yes, the hands are kept clean. So when you're out, carrying hand sanitizer with you. When you return home, washing your hands, thinking about other things that might have been contaminated and washing them. Also self-monitoring for symptoms and staying away from others, limiting contacts for those 2 weeks following, and presenting for testing if any symptoms do develop. We also know, again, prevention is the best approach. So if you have someone who is at higher risk for significant outcomes in your household, if you yourself have underlying chronic medical conditions, we do encourage people to find other ways to make their voices heard.
Thank you.
Thank you. Up next, we have Kate Porter with CBC Ottawa. Go ahead, Kate.
Hi, Dr. Etches. I wonder if you could paint a bit of a picture. I mean, I know we're always talking about COVID right now, but Ottawa Public Health's predominant job, is working with communities. And I wonder, seeing as you're speaking to just how different the health outcomes are for those in diverse populations, just what typically Ottawa Public Health is seeing or doing to to help improve things, I guess I would say.
Yeah, thank you for asking. One of the things we know as an organization at Ottawa Public Health is that we, first of all, need to take a look at ourselves and make sure that our own organization is doing the work, anti-racism work for ourselves to learn about, culturally safe ways of operating and orienting our services. We have a principle of community engagement and doing things with the community so that they're informed and making a difference to the people who need them in a relevant and effective way. So that means we're continuously reaching out to partners like the Ottawa Local Immigration Partnership, the Ottawa Aboriginal Coalition, and others who can provide us with insights about the needs of the community. And then, we look at adapting and working together to tackle them. So sometimes that means making things available in a different format or different languages. Sometimes it means advocacy. We we're all working together. We're working with these groups on improving our data, as I mentioned, but we know that the socioeconomic variables that are associated with poor health guide us even before we have the data to make sure that populations with more risk have more support. And that's why we saw with the COVID-19 response, one of the first things that was set up was an isolation center for people who are homeless. And we continue to look at whether there are specific supports needed during this COVID response based on those higher risks.
And then my other question, you did just refer to data. I know that in your opening comments, you spoke of, I think it was 3 times more likely in more diverse neighborhoods than not. Was that
have the chance to analyze it?
Great, thank you very much.
Thank you. Up next, Josh Pringle with CTV Ottawa. Please go ahead, Josh.
Thank you very much. Today, thousands of people are expected to gather for the march. The weather for the next week is looking fantastic. People are cooped up. Is there any concern about seeing a spike in cases as people start to increase their interactions moving forward? And what's your recommendation for people as people get out today for a march and over the next week as they start to get outside more because they're tired of being inside?
I want to recognize that people have understood the importance of physical distancing so far. And like Dr. Manuel said, we're even seeing as the mobility data grows, that we're not seeing the cases. And so it suggests that people are going about their activities with some distance between each other. So I encourage people to continue that. It is important. We know that the march may provide an instance where it's harder to maintain that distance. And so we will be monitoring for any increase in cases and letting people know if that's connected to any specific event or activities. When we look across the province, where we're seeing increases in cases, they're often related to workplaces, workplaces where it's harder to distance from one another indoors. And so this is the other kind of surveillance that we're doing, is looking at, are there any patterns emerging in the data that show us about different environments that need attention, working with workplaces proactively to make sure that they're screening people when they come into work, to make sure people who are ill don't work, making sure that workplaces are doing what they can to increase distance between employees. So there absolutely is the risk that cases will rise for many reasons. And we're trying to prevent that, as well as learn if we do see spikes, to prevent further transmission and break the chains, shut down the outbreaks as quickly as possible.
My follow-up question, we've received a couple of reports this week that the number of people at the Brewer Assessment Center seems to be lighter than normal, not many crowds. Are you happy with where the testing numbers are right now, or would you like to see more people presenting for testing so you can diagnose the cases that you do believe are out there, and you also have a better snapshot of what the situation is in Ottawa?
So it's been educational to look at the data of what we found with opening up the testing to the whole population. What we found is that there was a rise in the number of people presenting to be tested. So just so everyone knows, you can present to be tested whether you have symptoms or not at an assessment center. But what we found was, as the number of people tested grew, we didn't find a lot more cases. That percent positivity hasn't grown. And so it's telling us that population out there without symptoms, the general population may not be where we're going to find most of our cases. And so we're learning from that, and our goal, am I satisfied with the testing numbers? I mean, our goal is to use all of the testing capacity we have. So would I like to see the testing numbers increase? Yes, I would. But my desire is to make sure that we're testing in a smart way, that we're testing in settings where the risk is higher. So continuing the testing in long-term care homes of staff that work in long-term care homes. That's part of our plan. That again will push on our capacity. That's 8,000 employees across the region that we're planning to test twice in the month of June. 2 more times. So that's going to use our capacity and push on it. Looking at populations where the risk is higher, maybe based on work or based on other congregate care environments where it's hard to physically distance. These are the priorities for testing, and we're going to continue to learn and evolve. As I say, taking a look at what's the percent positive result that we see based on testing in different settings.
Great, thank you, Josh. Thank you, Doctor. Julien Colbert avec le droit. À vous, Julien. Bonjour, Julien. Il n'est pas là. Okay, so we'll move on to Blair Crawford with the Ottawa Citizen. Go ahead, Blair.
Hi, Dr. Etches. A question has been there's been some talk about regional reopenings, and I'm just wondering, because the Ottawa numbers have been quite low this week, whether you think that's sufficient evidence to argue for a regional reopening in Ottawa as opposed to Toronto, the hotspot.
I would agree with your assessment that the pattern of decreasing infection in the community is different in Ottawa compared to Toronto. So that is reassuring. It's something that we want to maintain. So again, encouraging all the people of Ottawa to keep it that way, that it's our actions that make it possible to proceed with more relaxing of the restrictions. So I am interested in being able to get more people back to work in a safe way.
Okay, and as a follow-up question, this might duplicate a bit about what Kate had asked about, but you had mentioned earlier in your remarks that you were looking at your own organization for elements of inherent racism, I guess. And I wonder if you could just elaborate a bit more on that, what you see and what you might improve.
Sure. So one of the priorities, again, for Ottawa Public Health, it's embedded in our strategy, is reconciliation. And so we started with the board members and the senior leadership, asking all staff, making opportunities available for Indigenous cultural safety training. And what we found there, the feedback was really positive, that a lot of people just didn't know a lot about what the history has been, what's happened, why there's a disadvantage, why there's a difference in health outcomes, sometimes by population, whether Indigenous or Black, African, Caribbean. There's a lack of knowledge about some of the things that drive those differences in outcomes, and people found it very useful. And then a good foundation to be able to then work with communities to take a look at whether our programs need to be delivered differently or reoriented. So the same thing, some of our team has participated in anti-racism training and is sharing their learnings. And this is the work that we're being encouraged to do by the community when we talk with our partners in the Ottawa Local Immigration Partnership, for instance. These are the kinds of things that we're told are a foundation as we go forward. And so we're committed to continuing to make sure that everyone has the opportunity to keep learning so we can best serve our community. I will also mention, the other kinds of things beyond just taking a look at ourselves, but the work we're doing with the community. I hope to share more very soon is around the mental health of the African, Caribbean, and Black community in Ottawa. So this stems from a report we did on the mental health of Ottawa. Again, a very much a priority in our strategic plan is to improve mental health, but we heard from the community when we did that report on the status of mental health in Ottawa that there wasn't enough information about ethnicity and differences by ethnicity. And so we've done particular research and study and work with the African, Caribbean, Black community to fill that gap Right now, we're working with the community through the process of understanding what the data means and making some recommendations. And so this is something we should see, early summer, that's then a roadmap. So there's some recommendations about how do we close the gap when it comes to mental health of different communities in Ottawa, and what are those actions that we need to take together. So this is the kind of work where we want to use the data and the science to inform recommendations and take action that we're committed to continue to do.
Thank you.
Thank you. Up next, Radio-Canada, Jérôme Bergeron. À vous, Jérôme. Jérôme?
Bonjour, désolé, j'ai la difficulté avec mon micro. J'ai une question pour vous, Madame Etches, concernant les quartiers diversifiés. Pouvez-vous m'en parler un peu plus comparativement à la province? J'en comprends que les statistiques à Ottawa sont plus élevées. Et selon vous, pourquoi est-ce qu'on voit ça chez nous? Est-ce que c'est parce que c'est des quartiers plus défavorisés également? Ou?
C'est complexe. Il y a beaucoup de raisons pour les relations entre l'ethnicité et les mauvais résultats, le taux des infections, par exemple. Mais une raison, c'est que les types des emplois sont plus souvent les emplois où il y a un plus grand risque d'avoir contact avec le virus. Aussi, c'est un lien avec moins avantages, peut-être dans des situations où c'est plus difficile d'avoir distanciation physique. Il y a beaucoup de différentes raisons. C'est vrai que la discrimination a des effets sur la santé de le corps. Alors, c'est possible avec les impacts pendant beaucoup d'années d'avoir plus d'hypertension, par exemple. Et hypertension, c'est un risque pour plus sérieux impact avec COVID-19. Alors, il y a beaucoup de différents facteurs. Mais le résultat, finalement, c'est un différent niveau de hospitalisation et des décès pour les populations minoritaires.
Et comparativement à l'Ontario, nos statistiques, si j'en comprends, sont pires que globalement en province?
Au comparaison de global, pardon?
Pour nos quartiers diversifiés à Ottawa, est-ce qu'il y a plus de... Est-ce que le taux est pire que dans un quartier diversifié de Toronto, par exemple?
Nous n'avons pas cette comparaison exactement. Le rapport que j'ai mentionné était pour la province en total. Je n'ai pas la différence entre les différentes régions.
Parfait, merci.
And that's all the time we have today. C'est tout le temps dont nous disposons aujourd'hui. Thank you for joining us. Merci.
Merci.